Communicable diseases continue to rank among the top 10 causes of morbidity and mortality in the Philippines. Despite advances in medicine and technology, infectious diseases such as tuberculosis, dengue, influenza, and COVID 19 remain persistent threats. These illnesses spread rapidly through person to person, animal to human, or environmental transmission, which means that our health responses must address both biological and social determinants of health. Prevention requires multi sectoral cooperation, from local government units to families and individual citizens. Nursing practice, especially in the community, must therefore be rooted in collaboration, surveillance, and health education. When we talk about burden, we are not just referring to the number of cases. We are talking about the economic, social, and emotional toll these diseases bring. Infectious diseases significantly reduce productivity, especially among breadwinners who miss work due to an illness. For communities already struggling with poverty, one sick member can mean food insecurity or loss of income. The most vulnerable groups include children, pregnant women, the elderly, and low income populations. These are those who often have limited access to quality healthcare services and preventive programs. Globally, the World Health Organization reports an increasing concern for emerging and re emerging infections, such as the SARS-CoV-2, Ebola, and even measles outbreaks that reappear when immunization coverage drops. This shows that the fight against communicable diseases is ongoing, and public health nurses stand at the front lines of this battle. To understand prevention, we must first understand how infections spread. We have direct transmission, which involves person to person contact, such as touching, kissing, or droplets released during coughing and sneezing. Diseases like influenza and measles are spread this way. We have indirect transmission. This occurs when an infectious agent or the causative agent survives outside the body. For example, through contaminated food, water, or objects. A common example is hepatitis A, which spreads through poor sanitation or unsafe water. And lastly, we have the airborne and bloodborne transmissions. These include diseases such as tuberculosis, HIV, and COVID 19. Tuberculosis being airborne, also with COVID 19, and also HIV as a blood-borne infection. These pathogens are carried either in tiny aerosolized droplets for airborne and through the bloodstream and body fluids for blood-borne transmission, making them more difficult and challenging to control. As nurses, understanding these pathways helps us teach communities appropriate preventive actions like hand washing, use of face masks, and safe food handling. Public health nurses apply a comprehensive approach to disease control. We ensure early detection, prompt reporting, and case management. The earlier a disease is identified, the quicker we can isolate, treat, and prevent spread. This is why routine surveillance and reporting are critical. Second, we have immunization and prophylaxis, which remain the cornerstone of disease prevention. Vaccines are among the cost effective public health interventions, protecting not just the individuals vaccinated, but the entire communities through the herd immunity. Finally, environmental sanitation, vector control, and safe waste disposal play vital roles. Simple actions such as covering water containers, proper garbage disposal, and maintaining clean surroundings can significantly reduce mosquito breeding and other vectors breeding sites. Thus, community health nursing interventions should always integrate environmental and behavioral measures, not just clinical treatment. Effective disease control begins in the community. We must involve community leaders and volunteers because people are more likely to respond to health programs when they are led by familiar and trusted individuals. This principle aligns with the DOH Healthy Pilipinas movement, which emphasizes shared responsibility for health. Promoting hygiene, sanitation, and environmental cleanliness goes hand in hand with community empowerment. When people understand the why behind these practices, they are more consistent in doing them. Third is encouraging participation in surveillance and vector control activities. This transforms communities from passive recipients into active partners. This is the essence of community based public health nursing, working with the people, not merely for them. Surveillance is the backbone of communicable disease control. This means continuous data collection, analysis, interpretation of health information to detect outbreaks early and guide timely responses. The Integrated Disease Surveillance and Response, or IDSR, of the Department of Health is a system that ensures diseases are monitored from the barangay up to the national level. Through this system, local health offices can respond quickly when cases begin to rise. Public health nurses contribute significantly through case finding and reporting. We are often the first to notice trends, identify contacts, and ensure that health records are accurate and up to date. Effective surveillance empowers community to act early, turning information into prevention. Among all of our roles as nurses, health education remains our most powerful tool. We must empower communities to recognize symptoms and seek timely care. For example, teaching families how to identify warning signs of dengue or TB can literally save lives. It is also essential to correct myths and misconceptions, like believing that antibiotics cure viral infections or that vaccines cause disease. Nurses, as trusted professionals, bridge the gap between scientific information and community understanding. Lastly, emphasizing healthy lifestyle practices such as adequate rest, balanced nutrition, hand hygiene, and safe sexual behavior reduces transmission and builds long term resilience. Education doesn't just change behavior, it includes building a culture of health. Public health nurses are the cornerstone of community health programs. We conduct surveillance, home visits, and contact tracing, often being the first to identify and manage emerging infections in local areas. We also provide health education and counseling, ensuring that individuals and families understand how to protect themselves. Beyond individual care, we coordinate with the rest of the healthcare team, particularly with the barangay health workers and rural health midwives, to promote teamwork and efficient service delivery. The public health nurse acts as both educator and advocate, meaning we ensure equity, access, and compassion in healthcare delivery. No single agency can control communicable diseases alone. That is why public health nurses must work with local government units, schools, and the private sector to plan and implement prevention activities. We also engage NGOs and international partners such as the WHO, UNICEF, and the Red Cross for technical and logistic support. Collaboration ensures sustainability, It pools resources, expertise, and community trust. We are reminded that interdisciplinary collaboration is a hallmark of population focused nursing care. It is how we achieve systemic and lasting impact. To recap, we have studied or lectured that communicable disease control is a shared responsibility. Success depends on surveillance, education, and active community participation. Public health nurses stand as the backbone of prevention programs, leading efforts that save lives, protect families, and strengthen communities. By empowering people, coordinating with partners, and continuously monitoring health trends, we nurses fulfill our ultimate mission to promote, protect, and preserve the health of the public.